Sure, why not? Go ahead.
Say go.
Go.
Alright guys, so we're here to make a change. We're here to save babies' lives so that an incident like this doesn't happen again. So we really want to make sure we focus a lot on the fishbone. So you got this. Good job.
I got it.
Alright.
Focus on the PDSA. Make sure we have a good plan to.
Alright.
Hello.
Hello.
Hi guys. Hi.
Haley and I want to welcome you to JACO. And can someone tell us what you are here for today?
Yeah, so to start, my name's Kelly. The situation was Mr. and Mrs. Quaid's twin babies had developed a staph infection just days after coming home from the hospital from being born. So their doctors had recommended that they be admitted to Cedars-Sinai Medical Center so that they could receive IV antibiotics, which is great. It appeared as if, the twins were doing really well on their second day in the hospital, so the Quaids decided to go home and rest for a little bit. However, while they're at home, the nurse that was caring for the babies had accidentally given the twins 2 adult doses of the blood thinner heparin. A safe heparin dose for a newborn is about 10 units, and they were given 10,000 units. That was 1,000 times a dose that the babies were supposed to receive. So when the Quaids had arrived to the hospital the next day, the babies were literally bleeding out of every possible orifice as their bloods had turned to the consistency of water. There was a series of errors that had led to this overdose that left the babies literally fighting for their lives. First of all, a pharmacy technician had made a mistake by putting the larger dose bottles of heparin in the same bin with the smaller dose bottles on that unit. Secondly, the nurse that was caring for these babies had grabbed the bottle out of the bin without reading the label. The 10,000 unit and 10 unit bottles are very similar in color, which led to this problem, and some say it's really difficult to tell them apart, so it's really important to be reading the labels. So just to clarify, this is not the first time that a similar incident like this has happened either. A very similar incident had actually killed 3 infants in Indianapolis a year before this Quaid's twins situation. So we're just here to, discuss evidence-based practices that need to be implemented so that a situation like this does not happen again, so that we can make sure babies are receiving safe doses of heparin when they're in the hospital.
So what type of practice are you guys planning on implementing?
Well, we really want to focus more so on evidence-based practice, and as you guys know, it's a problem-solving approach to practice that involves the conscious use of current best evidence in making decisions about patient care. So this is going to allow for systemic search for the most relevant evidence, critical appraisal of evidence to answer a clinical question, and it's going to consider the clinician's expertise and patient values and preferences, which is the most important part. So evidence-based practice is important because it can prevent errors such as the Quaid twin situation. It's going to provide opportunities for nursing care to be more individualized, more effective, streamlined, and dynamic. It's going to maximize effects of clinical judgment. It's going to help stay current with the latest technological advances and take advantage of new knowledge developments, and most importantly, maximize patient-effective care. What's considered evidence? So that would be research findings, knowledge from basic science, clinical knowledge, and expert opinion. And we feel that as healthcare professionals, any care we deliver should have a rationale to back up anything that we carry out, and we're expected to understand why we're caring for patients, and a rationale is provided for the care that we provide through evidence-based practice. So this is going to help us stay updated with policies and procedures, and it's really important that we keep our skills and knowledge current, which is going to enable us to provide the most effective care.
Okay, I see you have some sheets on the table. What are those? Are those for us?
Yes, the first one is the fishbone, which I think Joe was.
And I'm here to discuss the fishbone diagram. You can see here we created a diagram to show you the possible causes and the effects of what occurred recently. We determined that the 5 rights of medication administration were not followed, which is crucial to safely administering medications. There was not a 2 RN check of the heparin administration. And hopefully the second RN would have caught this mistake, but as we've seen, it's happened a couple times. The human error of drawing up the heparin and looking at the vial, not realizing it was well over the ordered dose. We like to implement an organizational system that would kind of allow for this to not happen again. Bad things and whatnot. We had a misread label, so we're going to reinforce that the nurses have to read the labels, which is again partly by rights of medication administration. And no one was checking the doses. The doses, not the nurse, the pharmacist, so there were a lot of oversights. And possible mixing of pediatric and adult vials. Failed to document the medication error. This might have been because the nurse didn't realize that a medication error was made, or just they decided not to document it, so it was not seen, and a possible cause for what was going on with these kids was further delayed. Nurse to patient ratio might have been a problem. We would always recommend increasing the amount of nurses, and the hours worked by the nurse might have been too much. We also have some more causes related to different topics. We have our staffing here. The patient to nurse ratio, the hours worked by the nurse, again, was this too much? And then did they have the same nurse for the twins? How acute were these patients, and should one nurse have had these patients? And then was a float nurse taking care of these patients? We know try to leave the more acute patients with the nurse who's regular on the floor and kind of knows more about what goes on there. Procedures. A good way to identify the patients. The patient was identified, but the medication wasn't given right. And a procedure for pulling the medications. This wouldn't have fixed the problem of getting the wrong amount of heparin set up, but if they're looking through the medications as they're pulling them out, then they would have seen that this is way more than the kid needs. 5 rights again, very important, and the double check by 2 RNs. And we would also like to suggest pre-filled syringes. Now, this would solve a problem of drawing up the wrong amount of medication, but it still really doesn't get rid of the error of pharmacies setting up the wrong pre-filled syringe and a nurse then giving it. So, even more importantly, technological advances that we would like to implement on the unit, such as online records, allow to scan the patient. The computer will tell you, hey, this is wrong. It's just a bunch of extra checks that currently aren't in place that we think will keep this problem from happening. And then the pharmacy versus the nurse, we realized there was problems everywhere. The checks weren't made. Like different labels on the vials. One of the problems was those the same color. We really like to differentiate between these two extremely different amounts of heparin. So this doesn't happen again. I think putting things that look very similar next to each other is probably not the best idea. And then again, with the lack of the 2 RN check, which led to our problem of the kids getting too much heparin and bleeding out from everywhere. Any question?
No, that's very representative of cause and effect. But as your team is presenting evidence-based practice as an approach, could you explain to Haley and I what evidence-based practice, or how it would stop further sentinel events such as the one with the Quaid twins?
Well, this is actually a good example of the PDSA worksheet that we filled out. In order to know what the hospital is doing wrong, or honestly countrywide of multiple hospitals, because this happens more than just this hospital, what's being problematic, we need to investigate how it started. So we use the PDSA worksheet. The PDSA means problem, do, study, act. So you separate each section to figure out what you're going to do. So before you begin that, you have to get a background. So how did we get to this point? What's going wrong? So clearly we know that the heparin being so close to each other, having the same colors, that's a problem. Nurses not giving it the right dose, not double checking like they should be, that's also a problem. Is it a hospital problem? Yes, but it also is a medication problem, and it's more than just this hospital, it's nationwide. So for the plan, we're going to research causative agents of the incident and create a change to prevent it from happening again using evidence-based practice. So in order to do this, we do a who, what, where, when, how. So who are we trying to fix? The patients who are receiving the heparin, adult and pediatrics. Obviously pediatrics is what we're talking about now. what are we trying to do? We want to give heparin in an accurate way and revise the way it's given because clearly it's a continuing problem. When will we want this to be implemented? As soon as possible. We don't want any more children, let alone anybody, getting the wrong dose of anything, not just heparin. And how we do this, we would like to change the colors of the vials and more training with nurses just so that we make sure that they do these checks. The next would be the do. We want to carry out the change. We want to train nurses to do these double checks. We want to have competencies. We want to talk to we want to talk about the pharmacies, about the medications, etc. So the next one is a study. And according to the article, evidence-based practice, clinical simulation works off an intravenous medication, moving towards safer practice. This is an article that was going through between 2005 area, and it focused on problems with medication administration, specifically dose calculations, and just safe medication administration in general. Ironically, 73% of the medication problems they had were anticoagulants, so that fits perfectly in what we're discussing. And they use multiple facilities in order to do simulations on educating these nurses to give better care, teaching them those checks. A lot of those checks, because these nurses were older, the nursing schools have changed, they weren't even knowledgeable of these type of checks. So they had these different hospitals go do these competencies and the simulations, and they had great outcomes. Actually, they had 46% of the nursing staff attended, and they had extremely good satisfaction rates, and they decreased the amount of errors they had just by going to these things. And lastly, how we're going to act on this. What have we learned from this experience? We've seen the bad, so now we need to focus on what needs to be changed, what is the good. So common risk reduction strategies that Joe's talked about too is 6 rights medication, really focusing on those things, double checking a heparin with another nurse, checking it again and again and again, those common things, and trying to get the heparin vials labeled more strictly. You can put them in different drawers if you need adult doses on pediatric units. I know kids come in all shapes and sizes now, so even if you have that, put them in different drawers, label them different colors, put boards on your things, on your drawers to recognize that these are similar, watch out. Just little things like that can make a big difference in taking care of your patients.
Okay. What is the concept of evidence-based practice when it comes to nursing?
Well, as nurses, we are the direct patient caregivers, so it's really important for us to understand what the national best practices are when we're providing care for our patients. So not only is it important for us to be knowledgeable of what the best practices are, but it's also important for us to understand how to come to these conclusions on our own and do our own research, not just relying on what statistics say or studies have shown. So to effectively apply evidence-based practice process, in addition to basic skills required to undertake nursing work, a nurse must have the ability to identify knowledge gaps, formulate relevant questions, conduct an efficient literature search, apply rules of evidence to determine the validity of studies, apply the literature findings appropriately to the patient's problem, and appropriately involve the patient in the clinical decision-making.
Okay. Well, we really like your presentation. We feel like we've received a lot of facts and a lot of information revolving the Quaid twins incident. So Haley and I will take it back to the board members, and we will get back to you.
Thank you.
Thank you.
Thanks, guys.